Mucuna pruriens, or velvet bean, is a tropical legume that might boost dopamine levels. This magic bean has been used for thousands of years in Ayurvedic medicine. Recent studies suggest it may help reduce symptoms of Parkinson's disease and infertility in men. It's also being researched for improving depression, sleep, and snake venom poisoning. Mucuna pruriens, or the dopamine bean. Mucuna is a tropical legume also known as velvet bean. In herbal medicine and Ayurveda, mucuna has been used for thousands of years as a remedy for male infertility, nervous disorders, Parkinson's disease, and as an aphrodisiac. Mucuna beans are sometimes called magic velvet beans. For researchers, this magic refers to mucuna's potential to improve brain health. For users, this bean's magical properties span from its alleged aphrodisiac effect, while others yet allude to the plant's subjective, simultaneously relaxing and stimulatory effect. Mucuna is known as the dopamine bean since it's a good source of L-dopa, around 4 to 7%, from which dopamine is made in the body. The high L-dopa content offers additional benefits. It protects the seed from insects and pests. Mucuna seeds are also a major source for commercially extracting pure L-dopa, which is used in the treatment of Parkinson's disease. Mucuna is a tropical legume traditionally used in Ayurveda. The National Centre for Complementary and Alternative Medicine states that there is some limited evidence that mucuna may have beneficial effects on some symptoms of Parkinson's disease, like motor function. Recent research uncovered that mucuna might also boost antioxidants and scavenge free radicals in the body, but this has not yet been proven in humans. Mucuna is originally from southern China and eastern India, but is now cultivated throughout the tropics. In the Himalayas and Mauritius, both the green pods and the mature beans from Mucuna pruriens are traditionally boiled and eaten. In Guatemala and Mexico, it's roasted and ground to make a coffee substitute widely known in the region as Nescafe. Aside from its L-dopa content, the velvet bean has good nutritional value. Although a legume, it's easily digestible and rich in minerals, dietary proteins, fatty acids like linoleic acid, and starch. Mucuna seed also contains mildly hallucinogenic tryptamines, psychoactive serotonin as 5-hydroxytryptamine, D-chiroinositol, a rare plant component that may help with diabetes and polycystic ovarian syndrome, newly discovered antioxidants, and potentially neuroprotective substances. Like most legumes, Mucuna pruriens also contains various anti-nutrients that limit its benefits and nutritional quality, including tannins, which may bind to proteins and reduce their digestion, trypsin inhibitors, which reduce the activity of trypsin that helps to digest proteins and other digestive enzymes, phytates, which can bind to minerals and block their absorption in the gut, cyanogenic glycosides, which are plant toxins that form a small amount of cyanide in the body, lectins, a significant source of food sensitivities according to some theories. The tannins in mucuna, being polyphenols, are not just bad, although they can reduce the absorption of proteins and cause digestive problems in sensitive people. They may also be beneficial in people without gut problems and autoimmune issues. Although more research is needed, scientists think that the tannins from mucuna may help to fight viruses and other microbes, inflammation, and high blood pressure. Also, these anti-nutrients are much lower in standardized extracts than they are in whole beans. The mucuna bean contains some anti-nutrients like the tannins, the phthalates, and the lectins. Limited evidence suggests that mucuna may have beneficial effects on some symptoms of Parkinson's disease. However, there's still insufficient evidence to rate its effect and safety. The L-DOPA in Mucuna is the main active component that may reduce the symptoms of Parkinson's disease. People with Parkinson's have low dopamine content in parts of their brain due to the impaired conversion of tyrosine to L-DOPA. Studies suggest that the L-DOPA from Mucuna may cross the blood-brain barrier and be used to make dopamine, restoring its brain levels and neurotransmission. Other antioxidants in the plant's seeds may enhance brain protection. However, others have pointed out that a larger part of L-DOPA from Mucuna may be broken down before it reaches the brain. To counter this argument, some scientists hypothesize that Mucuna may affect additional pathways in the brain, unlike pure L-DOPA, or that it contains compounds that help prevent the L-DOPA breakdown. These hypotheses have not yet been confirmed. In a clinical trial on 60 subjects, a powder derived from Mucuna decreased the symptoms of Parkinson's disease better than standard levodopa after 12 weeks of treatment. In another study, Mucuna was just as effective as levodopa treatment, but was absorbed and reached peak levels faster. Similarly, a single low-dose Mucuna powder worked just as well as the standard drug levodopa in 18 advanced Parkinson's patients, but caused fewer adverse effects. Higher Mucuna doses were even more effective and longer lasting than the standard drugs. These 3 studies suggest that Mucuna can be used as a complementary strategy in the management of Parkinson's disease. In one study, the daily intake of Mucuna resulted in 50% of the patients discontinuing use due to either gastrointestinal side effects or worsening of motor performance. No one in the medications group in the study discontinued use. For the patients who tolerated the Mucuna, the clinical response was similar to the levodopa prescription. Dopamine is one of the most important neurotransmitters for sexual behavior and libido in men. Its effects are pretty straightforward. An increase in brain dopamine levels increases the libido, while a decrease in dopamine and similar neurotransmitters, the catecholamines, reduces libido and sexual function in men. Mucuna is commonly used as a supplement for male infertility because of its dopamine boosting and antioxidant effects. However, few clinical trials support this use for male infertility yet. In one study of 60 infertile men, Mucuna powder at 5 grams per day improved sperm count, motility, and overall quality. In 2 other studies of over 250 infertile men, Mucuna also increased testosterone levels, aside from improving sperm quality. It could also boost antioxidants and balance other sex and stress hormones linked to infertility in men. Large-scale studies are needed to confirm these findings. What's more, the effects of Mucuna on fertility in healthy, fertile or subfertile men are unknown. All of the above studies administered Mucuna only to infertile men. Limited data points to Mucuna's potential to improve male fertility, but more research on this is needed. In one trial, Mucuna seed powder reduced psychological stress and cortisol level in 60 infertile men after 3 months. Researchers believed that the plant may help to better manage the stress, but this is limited to infertile men and may be linked to its fertility-enhancing effects. High follicle-stimulating hormone and prolactin levels signal that the pituitary gland is not functioning properly, and it can impair the function of the testes and reduce fertility in men. Mucuna decreased prolactin and follicle-stimulating hormone levels in 2 clinical trials of over 250 infertile men. Mucuna probably balances these hormones by boosting dopamine levels, which reduces the production of prolactin and follicle-stimulating hormone. High levels of prolactin may also be a result of low thyroid hormones, pituitary tumors, psychiatric drugs like antipsychotics, or other causes. Whether Mucuna can help to reduce slightly increased levels in conditions other than male infertility hasn't been tested. In a study on 18 people, a combination of mucuna with other tropical herbs improved sleep quality by 50% after 4 weeks. It's well known that dopamine is important for focus. In one study of 85 children and teenagers with ADHD, a combination of mucuna with vitamins, minerals, and other supplements like vitamin C, calcium citrate, B6, folate, lysine, cysteine, and selenium improved symptoms in 77% of the cases. Mucuna extracts are traditionally used by Nigerians to prevent snake poisoning. The powder is prescribed by traditional healers as a pre-treatment for snake bites. The healers claim that a person who swallows the intact seed will be protected for 1 year against any effects of any snake bite. In one study on rats' hearts, mucuna powder protected the heart-damaging effects of cobra venom. In another study, mice pre-treated with a mucuna extract secreted more antibodies against viper venom. Mucuna contains a sugar-bound protein similar to snake venom proteins, which stimulates the production of antibodies. Scientists hypothesize that these antibodies may stay in the body for long periods of time and prime the immune system, similar to vaccines. They might be able to cross-react with the actual snake venom once they come in contact with it, potentially protecting against serious poisoning. We talk about serotonin and norepinephrine much more often than we talk about dopamine when it comes to depression, but scientists are starting to realize that dopamine usually is associated with motivation and feelings of reward, and this may play an equally important role. It's not so much that low dopamine in general can trigger low mood. Rather, its deficiency in specific parts of the brain is what might trigger symptoms. Low dopamine in the brain's emotional, mesolimbic centers may cause the inability to feel pleasure, which is common in depression. Low dopamine in cognitive, mesocortical areas may trigger a lack of motivation that people with depression often suffer from. Scientists suspect that dopamine-boosting action of mucuna improve mood and symptoms of depression in mice. It also reduced their stress levels, showing all the desired characteristics of a good antidepressant. Mucuna is traditionally used to help fight parasitic infections, but clinical studies are completely lacking to support this use. Folk healers claim that mucuna is mild anti-parasitic. They often use it alongside other parasitic cleansing treatments. In lambs, mucuna seeds slightly reduced the number of parasites, but did not clear the infection. In goats, it improved digestion, but didn't reduce parasitic infection. In cells, its seed oil could paralyze, but not kill parasites. In mice, a leaf extract of mucuna reduced seizures. It also reduced a type of muscle rigidity called catalepsy that's linked to seizures, schizophrenia, and Parkinson's. Scientists are exploring whether it has anti-seizure effects due to the mixed effects of its L-dopa, serotonin, and antioxidant components. Mucuna contains an inositol called D-chiroinositol, which can mimic the effects of insulin and might help to lower high sugar levels. A high dose of the seeds reduced blood sugar levels in mice. Thanks to its antioxidant potential, mucuna extracts are being researched for protecting skin cells. Scientists are hoping to see creams and gel with mucuna for skin diseases such as psoriasis, dermatitis, and eczema, but many more studies are needed before this becomes a reality. Velvet magical beans do contain some tryptamine compounds, which are known psychedelics. Their concentration is probably very low in most available supplements, though. In some animal studies, mucuna had mild hallucinogenic and sedative activity. Therefore, it's theoretically possible but still unproven, that Mucuna beans might have mildly relaxing and psychedelic effects. Animal and clinical studies are needed to confirm this. Some people report dreamy feelings from taking Mucuna, but it's unknown if Mucuna actually has these properties. The following side effects were reported in clinical studies: nausea, abdominal discomfort, rare vomiting, and rare insomnia. Serious side effects or changes in blood test values were not reported. A Mucuna overdose can cause a headache, movement disorders, fatigue, tremors, fainting, and thirst. Mucuna has a high L-DOPA content, which raises dopamine levels in the brain and the body. Increasing dopamine levels or using L-DOPA could be dangerous in some people, including those with conditions like glaucoma, heart arrhythmias, chronic nerve pain, stomach ulcers, and psychosis. Some antidepressants and anti-Parkinson drugs may interact negatively with Mucuna. Other medications for depression, like tricyclic antidepressants, some antipsychotics, like D2 antagonists, some anti-diabetic drugs, and some medications used during surgery should all be avoided in combination with Mucuna. The safety of Mucuna has not been established in children, pregnant, or breastfeeding women also.